next speaker is Dr. John Ring, and John's a gastroenterologist, so that's a bowel doctor. John consults in Bacchus Marsh, and he also works at Royal Melbourne as a liver specialist as well. But today he's going to be talking about bowel cancer. Take it away, John.
Thanks, Raven. When I said to Raven I get very nervous about these sorts of things, he said, don't worry about it. I said, do I need to prepare anything? He said, no, don't prepare anything, but perhaps that was wrong. It's nice to be talking to a group of men because it means I can probably swear a little bit. I'd just like to tell you a bit about myself. My name is Dr. Ring, and I'm a bum doctor. It used to be, that's not my real name, I had it changed. It used to be arsehole. But the truth is that actually it's Irish. It's an Irish name. I come from a long line of Irish plumbers. It used to be O-ring, but we just simplified it. So that's my speech, basically. Is there anybody in the room over 50? Could you please put your hand up? Okay, keep your hands up. How many? All those who have done a fecal occult blood test, put your hand down. So if you haven't done one, keep your hand up. That's very good. That's excellent. As you know, when you turn 50, which is the time at which colorectal cancer starts to increase, the government sends you a little kit, which involves sitting on the toilet on a couple of occasions and taking a toothpick and collecting a little rice grain size of poo and playing with it for a little bit, putting it in the thing and sending it off. The uptake for that is about 30%. So I think people in this community are doing really well, if they're telling me the truth. So now that you all feel really good about that, I'd like to say that out of all of you in the room, about 1 in 10 of you will die from colorectal cancer. Okay, so that's quite a sobering thought. The incidence is, it's more common in men, and the risk factors are obviously age. So once you get over 50, the rate of occurrence of colorectal cancer starts to rise. If you've got a family member that's been affected by colorectal cancer, then your risk is higher also. And then there are some lifestyle factors which are remarkably similar to the diabetes risk factors. So if you're overweight, if you smoke, if you drink too much alcohol, I'm watching all of you, and if you don't do enough exercise, then your risk is also increased. But the good news about that is that we can do something about smoking, exercise, diet, weight, and if we do, then we can significantly reduce our risk. I think that's probably all. What I really wanted to say was that once you get to 50, you need to do that test that you get from the government, and that you need to concentrate on those basic risk factors that we heard about with diabetes to reduce your risk. And if you've got any concerns, then you should always speak to your local doctor, and they're going to guide you towards me, hopefully.
Thank you, John. Thanks, John. Any questions at all?
Sorry.
Yes, mate.
How often should you have these tests?
Well, probably every 2 years, a fecal occult blood test. The Lions Club do a drive every June, I think it is, with their bowel scan. That's not a bad test. The national government have decided that they'll send you one when you're 50, when you're 55, and when you're 65. The reason that they've done that is to do with cost. And as I said, they send out tens of thousands of them, and only about 30% of them are returned. So they're limited a little bit by their budget, but your best interest would be served by doing one every couple of years, and doing it every year is not a bad idea.
Russell.
John, can you make a comment about how often or who the people are who should have colonoscopies, in addition to or instead of...
Just talking about, Russell just asking about when colonoscopies are needed and how often for certain populations.
Yeah, so a colonoscopy is the ideal test. It's highly accurate, and also most cancers form in polyps. 98% of cancers form in polyps. So what we're looking for are polyps. The way the fecal occult blood test works is that polyps bleed microscopically, and you can't see that in your faeces. But if you do the test and it's positive, that means there's some blood there. and that may indicate that you've got a polyp. So then you go on to have a colonoscopy. But obviously if you have some overt rectal bleeding, so you're sitting on the loo and you see some bright blood, then you should go to your doctor and should have a colonoscopy. On an individual basis, if somebody comes to the doctor and says, you know, I'm worried, I've had a change in my bowel habit, I've seen a little bit of blood, not sure, then a colonoscopy is the best test. So fecal occult blood test is for screening the population. Colonoscopy is the best test for an individual.
I'm not sure how applicable this is to
That's
colorectal cancers, but
sorry.
there's been a number. I've read a number of articles from a lay perspective recently that in the ASCO and kind of the Lancet things, they seem to be implying that 2/3 of cancers are completely unavoidable. Now this is just something they're stating. So
Yeah, could I say that that's completely wrong? Maybe you read it incorrectly, but that are avoidable or unavoidable.
no, unavoidable. Yeah.
Despite what you do.
Despite what you do, that they were implying that only 1/3 of cancers were,
Yeah.
you might call it avoidable.
Yeah, that's a great question because it's so wrong. So don't listen to him. Shut up.
He's visiting from London and he's Irishman too, so I think he's still celebrating St. Paddy's Day maybe.
No, seriously, thank you for that question. 99% of cancers occur in polyps. So polyps are like little mushrooms. They look like champignons. And they're very similar in that they grow in the dark and they're fed on bullshit. And if you find those polyps and remove them, you virtually remove the risk of colorectal cancer. But your point's valid because there are about 1 or 2% of cancers that just pop up in the colon in the absence of polyps. And there's no real way to look for those. So knowing that they occur mostly in polyps, our strategies are aimed at finding polyps. And the basic strategy is the fecal occult blood test or colonoscopy. Do you accept that answer? No, that is the truth of
I'm
it.
more concerned about the message of sending out maybe to people that no matter what you do, you can't avoid it, which I think is a very bad message.
Yeah, I agree. Yeah, no, and I think it's wrong. I don't think that's true.
So
and-
I'll answer a little bit from a GP perspective. There are many cancers that can be prevented or screened for before they happen, and colorectal cancer is but one of them. In the female population, there's also cervical cancer as well. So we've got screening methods, and that's what the fecal occult blood test is, a screening method to see you may have cancer or you probably don't, but it's a way of checking. And we've got more specific tests like a colonoscopy to actually check fair income. Do we have something there in the bowel or not that could be leading to cancer? So many of these things are preventable.
So this gentleman asked a question that was relevant to that, and it was how accurate is a fecal occult blood test. So a fecal occult blood test will find, depending on the test, about 7 out of 10 cancers. So the Lions Club one is probably about 6 out of 10. The National Bowel Cancer Screening one's probably about 7. There's another product from a company called Entrix, which you have to pay for, which is about $20, which is about 8 out of 10. So meaning that it will miss 2 out of 10, which is why you need to do them every couple of years. The natural history or the time that things take to turn from nothing to a polyp to cancer can be 5 to 2, 3, 4, 5, 6, 7 years. So if you miss it 1 year, you'll pick it up the next year or the year after that.
You have a question?
Oh, it's more of a comment. G'day, John.
Hi.
My dad 5 years ago got bowel cancer, so he was probably one of the 70% that didn't take the test, so
Yeah.
he was about 68 or 69. And surprisingly for me is that he was getting all faint and sort of losing colour in his face and everything. Went to the hospital because he passed out, and they then found that he actually had bowel cancer. So, from an age perspective, I couldn't believe it. He's probably from an era that doesn't actually quite look at his arse when he does shit, which I couldn't believe because me and my mates joke about that stuff.
Yeah.
But Dad never did it, so he was probably passing blood, never knew about it, and all of a sudden, bang, he's got cancer. So, it's really important that we get past that stigma of what we do in the dunny and actually really inspect it, look at it, and if we think we've got an issue, get to it. And John, you know me intimately, I don't know you that well. But
I was asleep at the time.
I passed blood, and that for me was a real alarm bell. So I went and saw Rav, then went and saw John, got inspected, and everything looks like it's fine.
Yeah.
So,
And the important thing to remember about that is a family history. So if you have a family history of bowel cancer, you need a colonoscopy at some stage. So it's worth having a chat to your GP and worth having a chat to a gastroenterologist about that as well. So that's a really good take-home message. We've got a friend of mine here who's also had bowel cancer, and I'm sure he's happy to have a chat to you about it. He's thankfully recovered from it, and he's done very well, but he got it at
42.
42, yeah, with a family history. So
I
yeah.
was 42, stage 3. Had a mother who had bowel cancer. As a family, we're all told to have regular colonoscopies. I was a peanut, didn't do it. Had a bit of blood in my stool, shit, whatever you want to call it, but it was purple. It was internal. I changed my diet because I went to my local doctor and he said, oh, you got high cholesterol. So he said, you better change your diet. So I started eating cereal. And this cereal had purple berries in it. I let this go on for 3 months. I thought I'm just pulling out berries. Typical male, now it's going to stick out my backside. So I stopped eating the cereal, doing my own little experiments at home. 3 months later, right, this is 6 months, I'm still pooing fucking purple. Bits and pieces. So I went to my GP, told him what was going on, said my mother's situation, bang. Straight in, colonoscopy, I was stage 3 bowel cancer. So it was, just got it. It's been 5 years now, but I was an idiot. Dead sick.
Thanks for telling us about
Thanks,
that.
Joe.
I think, I don't want to sound all doom and gloom. I think it's, as you said, very preventable. We've got good screening tools for colorectal cancer. And if you are diagnosed with a cancer, the majority are diagnosed early and are treatable with surgery. I think there's often a lot of fear around presentation to the doctor, and you think that it's all going to end badly, and so you delay going. And I think that's obviously a mistake. And so I encourage you, if you've got any concerns at all, to speak to someone.
Yeah, one question there, mate.
Yeah, actually, why is it happening now? Like, when I was a kid, we never heard of cancer.
Yeah.
But now it's more prevalent every day in every way
Yep.
of life.
Good question.
I think that the people are living longer, and they're not dying from other things.
Yeah.
And so cancer as a cause of death is becoming more common in the community. Bowel cancer is the second most common cause of cancer after lung cancer.
Breast cancer.
Well, sorry, when we put men and women together,
Yeah.
it's lung and then bowel, I think. I'm not quite sure. It's different for men and women when you separate them out. But we're not dying from other things like we used to. So we all, heart attack or stroke or...
Probably this is irrelevant, but I'm playing bowls with 3 women that have got very, very long hair.
Yes.
They're all shaving their hair off. And I think that's really gutsy for them to do, because that is a sign they're like in relationship to cancer. Like they're
Oh, you're
supporting
saying...
it.
Oh, okay.
They're going to shave all, and, But why is it overall happening now in this 50s, 60s, 70s? We never heard of all
Well,
this
yeah.
cancer.
No, I think it's because the population's getting older and it
So what
occurs
we
more.
eat, no?
There's a whole heap of factors, and we'll perhaps have a chat about it later. But a part of it is that we're living longer, as John said. Part of it, we're diagnosing it better. So in the old days, a lady may have died from ovarian cancer. No one would have had a clue what that was. Now,
These young children.
yeah, but now we've got screening methods and tests, and blokes die from pancreatic cancer. We now know it's pancreatic cancer. I think many years ago we probably didn't know. This guy just died. We don't know what happened to him. So we're better at diagnosing it. So like for instance, in children, there's autism has gone up. The reason is we're diagnosing it more. We probably had lots of autistic kids in the past, just as an example. So we're diagnosing it better. We know more about it, and so there we've got better figures because we're understanding it better, and we're living longer. 50-year-old blokes not dying from heart attacks as much as they used to. They still are, but they're not as much as used to. So we're getting an ageing population, so therefore the age is one of the risk factors for lots of cancers, most cancers.
This is probably the only spot you can ask this sort of question. Would there be a point in being more gentle to our bowel? Like the old apple a day, or the way that if you get obstructions that we treat it a little bit earlier than we think, you know what I mean?
Yeah.
Just being...
Diet is important, yeah.
Yeah.
Herman's just asking about the diet and an apple a day and that type of thing for helping with the bowel.
Well, I think diet is very important, and we know that if you eat more fresh vegetables, then the cruciferous vegetables like cauliflower and broccoli may actually help reduce the incidence of bowel cancer. So diet is very important. We know there's a great study where the Japanese people that had a low rate of colorectal cancer, when they go to America and eat an American diet, the rate of colorectal cancer becomes the same as the American population. So diet is very important.
And we'll talk a little bit about that with Ellen a bit later with the dietitian. Yeah, Jamie, one more question?
Yeah, just going back to the polyps, do most people have polyps in their body, as in bowel and that, or is it something else, hereditary or...
So the question was, does most people have polyps in the bowel or not?
No. So most cancers form in polyps. If you do one of those, your lifetime, your yearly risk of getting a polyp when you're 50 is about 1 in 50 or 2% per year. If you do a fecal occult blood test and it's positive, about a third of those, well, if you do a fecal occult blood test and it's positive, you shouldn't be too alarmed. You should have a colonoscopy. Most of the causes of that positive test will be something like a hemorrhoid. About 25% of those patients will have polyps, and about 5% will have a cancer. So cancer is actually the least likely result of a positive fecal occult blood test, but you still need to check it out.
So one more question from over here, was there? No, we may...
You've actually answered mine. Mine was, is there a relation between polyps and cancer, which you've already
Well,
covered?
they all virtually occur in polyps.
Are there other symptoms that you can get away from blood?
No, I'm going to say no, and the reason I'm going to say no is because by the time you're having symptoms, it's probably advanced. So, you know, obviously if you've got an obstructed bowel or you're bleeding profusely from your bottom, that may signify advanced disease. But the message that I'm trying to get across, I think what we want to get across is that usually there are no symptoms, which is why you need to do your fecal occult blood test when you're 50, or if you've got a family history, discuss that with your doctor.
Right, one last question from Darren, we'll quit on this
Just one
one.
last one, John. Why didn't you check my colon while you were there? Now I'm going to go and see someone else to have a crack around. Why don't you blokes do it all at once?
Did I not?
I don't know, did you?
I can't remember. I did something to you, but I can't remember what it was.
Now I'm going to get someone else.